Hi and welcome to Lessons from the Grand Rounds. So this is a video for all the newly joined hematology residents and medicine residents or pediatric residents who have their hematology posting. So during that period, as a hematology resident or a medicine or a pediatric resident when you are posted in hematology, so this video is to guide you to read more efficiently during that time. So wherever you work, I don't think you have less than 12 hours of duty. So you will have 12 hours of intense duty, and you will be completely exhausted in that clinical work, and reading after that is nearly impossible. So into 11 months into my residency program, I used to work around 12 hours a day and had eight 36-hour shifts. So during that time, it was very difficult for me to actively read. So over this 11 months with 3.5 months of transplant and cellular therapy postings, I have learned about 5 to 6 good resources which will help you read and grasp hematology both passively as well as actively. So we'll be going through this one by one. So the first and most important is a resource is an app which is up to date, which is used by most of the medicine and most of the other residents as well. I highly recommend that you have up to date, on your phone with that 2 GBs of offline data, offline documents and the graphics. So up to date is commonly used by us where we have renal or hepatic dose adjustments of the antibiotics or antifungals or immunosuppressive agents, and we see a lot of drug interactions, especially in post-transplant patients who are on multiple immunosuppressive drugs or monoclonal antibodies, and also our chemotherapy agents. There is significant amount of dose adjustment when the patients have renal or hepatic dysfunctions or the patients are in mods. So I feel that this is a very good source to start um, utilizing. And it becomes a must resource while you are a resident or you are a consultant. This is a basic daily basis source, both in hematology as well as medicine in general. The second source is also an app which is called as MDCal. So over 11 months of my residency, I used to make protocols for chemotherapy agents, protocols for transplant also, and we used to discuss about the baseline characteristics of the disease, like for example follicular lymphoma or DLBCL, and then we characterized them on based on the prognostic scoring system, that is IPI, CNS IPI, and then decide about other management. So commonly I use MDCal for calculating the body surface area, ideal body weight, adjusted body weight for chemotherapy and transplant high dose chemotherapy agents. Also for create clearance, also for the hematopoietic stem cell transplant comorbidity index, H score in HLH, IPI, CNS IPI, FLIPI scoring, and few other formulas and a scoring system which we commonly use like wells and all. So up to date is done. The second source which we discussed was MDCal. The third source which I found to be very useful, which is how I treat series. So for example, if I see a case of atypical CML, and um, I found it I found that the easiest resources to read is how I treat small articles. So it is usually 5 to 7 pages of articles where they uh, provide a very good overview and give treatment and diagnostic algorithms. So if someone wants to read atypical CMLs or some other topic which you see in your OPDs in 30 minutes, I feel this is the go resource. So I feel how I treat series, which is a very extended series, right from 1990s to 2026, the updated series will be a very good resource to start reading about a topic when you have less amount of time and while you're traveling also. The fourth important resource, which I feel is a very important resource, especially when you want a passive reading or a sort of a lecture or webinar series, I feel that is Mumbai Hematology Group webinars, uh, which is by the name of Perfect Square Hematology on YouTube. So they release videos which were conducted on Saturday and Sundays webinars. You can also subscribe them. You will get a mail, then you can register, and then you can also attend them live. but then all the live videos which are there, I think in a week they upload it on the YouTube in the live section, and they have multiple international and our Indian faculties as well, which are absolutely beautiful in their concepts. And in those 30-40 minutes of those webinar, you will get all the latest resources, all the concepts, and you'll also get the audience questions, and then you'll learn from them. So fourth resource was Perfect Square Hematology, Mumbai Hematology Group webinars on YouTube. The fifth source is Twitter. So this is something which is for mainly for updates. So we have AML Hub, we have ALL Hub, we have Lymphoma Hub, and we also have CML Hub. So these are such hubs which you can follow on Twitter or X, and then you'll get updates on your notification. And selectively, that has been coming to me from Twitter, and whenever I get time while I'm traveling to home by metro, I open up and I see, and these are very great resources uh, for updates especially. The last resource is to just to guide you about the books. So sixth point is about the books. So when I started to read a few things from Hoffman, I found that the text was very lengthy. We usually lose a bit of concentration after reading from 15 to 20 minutes. So good for concepts, good for basic, good for very good for benign hematology, because malignant hematology is very much evolving, and you have more and more articles from American Journal of Hematology or British Journal of Hematology or How I Treat articles, or ASCO guidelines. So for malignant part, we'll have articles and different series which will come and evolve the data and the guidelines. Whereas the benign part is absolutely exclusively given very nicely in Hoffman. The other resources include the ASH SAPS and ASH ED, which are small 800-900 pages book, which is very good if you want to start something and read in small amount of time. ASH education, I feel, will have all the updates, and SAPS will have the basics. And you also have the EBMT manual for both CAR-T as well as transplant, which is very crisp and very nicely given. So you can refer to that. So this was all about the 6 common resources which you can refer while you are working in hematology department, if you are a medicine or a pediatric resident, or you have just started your hematology residency program. Thank you.